Chapter 28, Oral Diagnosis and Treatment Planning. Sound dental care begins with a thorough examination of the head, neck, and oral cavity. For the dentist to make an accurate diagnosis, he or she must review the medical and dental history and discuss all dental health concerns with the patient. Continue with a thorough extraoral and intraoral examination. Evaluate the radiographs and study models, and discuss the plan of treatment. Why patients seek dental care. As a new patient to begin dental care, as an emergency patient when in pain or experiencing discomfort, for consultation with a specialist, as a returning patient for continued assessment and care. The role of the dental assistant includes assisting the patient with completion of patient information forms, take and record vital signs, chart and record the dentist finding during extraoral and intraoral examinations, expose intraoral and extraoral radiographs, take preliminary impressions and fabricate diagnostic models, take extraoral and intraoral photographs, and organize the patient record, prepare for case presentation. Visual evaluation. The examination always begins with a visual evaluation of the patient's extraoral and intraoral conditions. This enables the dentist to determine an overall assessment of the type of dental care received previously and reveals any existing conditions that have not yet been treated. Palpation. The examiner uses his or her fingers and hands to feel for texture, size, and consistency. This technique is especially useful for detecting extraoral swelling that is primarily a way of detecting swollen lymph nodes. Instrumentation is the use of instruments to examine the teeth and surrounding tissues. Type of instrument commonly used is the Mouth Mirror and Explorer. And the type of instrument used to examine the gingival tissue is the periodontal probe. Detection. Dentist uses the Explorer to detect imperfections in tooth surfaces, and probing, the dentist or dental hygienist uses the periodontal probe to assess the gingiva for the presence of pockets. Digital diagnosis. Some areas of digital dentistry, like carious lesion detection, occlusion and TMJ analysis, dental radiography, patient education, shade matching, and the computer-aided manufacturing system and intraoral imaging. Photography, a diagnostic tool used for intraoral and extraoral structures, and provides the dentist and patient with a visual means of identifying and understanding specific problems. Recording the dental examination using charting symbols, abbreviation, and color coding can be used in the recording process to indicate various conditions and existing restorations. Anatomic and geometric designs are the most frequently used dental charting systems. Anatomic diagram resemble the actual crown of the root of the tooth, and geometric, a circle represents each tooth and is divided into the surfaces. With tooth numbering systems, we have the universal numbering system. This begins with the maxillary right third molar and concludes at the mandibular third molar. The ISO FDI system assigns a 2-digit number system to each tooth. And the Palmer notation system uses a bracket to designate the 4 quadrants of the mouth. In color coding, a visual notation to differentiate between treatment that has already been completed and treatment that still needs to be completed. Black or blue symbols represent dental work that has been completed. Red symbols indicate treatment that needs to be completed at future dental appointments. Once work has been completed, you will mark over the red with black or blue notation to indicate that the work has been completed. Black's classification of cavities. Standard classification system is universal to all dentists and is used to describe the location of decay and is best method for restoring a tooth. Abbreviations for single surface restorations. Charting abbreviations are based on the name of the tooth surfaces. In multiple surface restorations, two or more surfaces are involved. The combination surfaces become one name on which the abbreviation is based. Dental charting systems are available in a variety of diagram styles. Symbols are placed in the tooth diagram of the dental record to represent the various treatments and the types of dental material used to restore the teeth or tooth. Important to learn the charting symbols for treatment to be completed as well as treatment already provided. The role of the clinical assistant is to escort the patient to the clinical area for the examination process. You will follow a routine protocol for the patient. The patient is seated in the dental treatment area, draped with the patient napkin, and positioned for the dentist to begin the examination. Soft tissue examination involves a complete examination of the cheeks, mucosa, lips, lingual and basal alveolar bone, palate, tonsil area, tongue, and floor of the mouth. This examination requires the use of visual assessment and palpation. The purpose is to detect any abnormalities in the head and neck area of the patient. Examination and charting of the teeth. The dentist examines each surface, each tooth, and dictates findings to the dental assistant, who records the findings on the clinical examination form of the patient record. It's essential that all entries are recorded correctly and accurately. Specific periodontal findings to be recorded are the overall health and condition of the gingiva, signs and locations of inflammation, location and amount of plaque, areas of unattached gingiva, areas of periodontal pockets measuring greater than 3 millimeters, presence of furcation involvement, and mobility. There are types of treatment plans being level 1, emergency care, level 2, standard care, and level 3, optimum care. With treatment plan presentation, an appointment will be scheduled to present the treatment plan to the patient. This is typically a 30 to 1 hour appointment without interruptions. It might include photographs, diagnostic casts, models. After presentation, a fee estimate is given. If the patient consents, finances are secured, and the treatment is scheduled.